Hi, I'm Dr. Paul Fisher with Gold Coast Chiropractic. Today I want to talk a little bit about spinal instabilities and how that can cause headaches. So these are two bones at the base of your neck. The first one is the atlas, and based after the character in Greek mythology because he held the world on his shoulders, which is very appropriate because this is your world and it's right here. The next one is axis, so named because this is where the rotation happened. Now, in between these two bones in your skull are a multitude of ligaments. Now, what can happen in a car accident, sports injury, a fall down a flight of stairs, or a similar trauma, even being born, these ligaments can be damaged. And as opposed to this joint being nice and tight, we have ligament laxity. Now, when that happens, you can have a few things. One, and most frequent, is you get pain in that area. It's a dull, deep, boring pain feeling at the base of the skull that can go throughout the entire head. And because this is where your brain meets your spinal cord and goes to the rest of your body, you can get all other sorts of kind of honestly goofy symptoms because that area is so important. Any number of odd things can happen. Now, at Gold Coast Chiropractic, what we work to do is to help treat this condition. Now, what we do here is, these are these two bones again on the top of your neck. We work to stabilize these ligaments. Now, when you're in an accident or trauma like that, very rarely is it just this joint that's injured, the entire spine gets injured, and when that happens, you can lose the curve of the neck. Normal should be like this, and then after trauma, it can go like that. Now, we can work just on this area and try to stabilize these ligaments, but unless we work on the entire curve, all that energy will be for naught. The reason being is your head is effectively a 14-pound bowling ball. When it sits on top of your neck like that, the weight's evenly distributed. But just like a bowling ball, as it gets out further and further, it effectively gets heavier and heavier. So when you stretch this out like that, that's a lot of pressure on those ligaments. They're constantly strained, constantly under stress. They never just get a chance to heal. Now, a question I get a lot is, as chiropractors, we're working to restore the normal motion. Can't that cause ligament instability? It's an excellent question. And the short answer is not really. The reasons being, the first is we stay within the normal range of motion of the joint. Also at this office, with areas of severe instability, we use instrument-aided adjusting, very precise, very accurate. But most importantly, we're again staying within the normal range of motion. And then secondly, the amount of force necessary to tear a ligament, as great as we all think our hands as chiropractors are, we just can't generate that amount of force to cause that kind of damage. What we find is more important, or what we find that happens more often, is that people with ligament damage come to a chiropractor's office and then are diagnosed with it afterwards. Ligament damage, very common cause of neck pain. And the reason that a lot of people continue with this issue even after seeing a chiropractor, a physical therapy, or a medical doctor is that it's not properly evaluated. At our office, what we work to do is evaluate not just what your issue is causing, but also the cause. So most often we see we've got to normalize that curve and get that normal motion back. So if you've been in an accident, have headaches, or think that you may be suffering from ligament instability, please be more than happy to help and see if we can help. I'm Dr. Paul Fisher with Gold Coast Chiropractic. Thank you, and have a nice day.